Good morning and welcome to another edition of the World of Naturopathic Medicine with me, your host, Dr. Veronica Haydock. And before I get started on today's topic, I'd like to wish everyone a very happy Holi. This episode for today I'd like to talk about is something I see quite a bit of in my office, and that's fatigue. People coming in always so tired. Many have gone to doctor after doctor trying to figure out why they're so fatigued, or sometimes it just comes down to looking at your lifestyle and making big changes with it. It's really a problem I find out there. People are just not getting enough sleep, and so that's absolutely critical to be looking at your quality of sleep. The body needs at least 5 hours. Less than that, you're really cutting corners and won't heal, can't heal. So if you have a concern to think about and you're just not sleeping well, then how you expect to get better and stay better. So definitely making sleep a big priority. Future segments, I'll actually be mentioning more tips and tricks on treating insomnia and what we can do about it. So some things to think about as a cause of fatigue and to help your doctor reason with you is looking at hormone issues. In a previous segment, I talked about the thyroid. Hypothyroid in particular is a symptom of being tired all the time and can't make any sense of it. Other things that I see that I'll be mentioning in a previous segment is the adrenals. The adrenal gland helps regulate the body's chemistries in addition to the thyroid level, and they do work in tandem. I find most traditionally trained medical doctors don't really delve into too much with treating adrenal issues. Another thing to think about, an early warning symptom of fatigue is diabetes. So if you're having really fatigue and it just doesn't make sense and you're sleeping well and may have been finding that you're having to use the bathroom more often than usual, very, very thirsty, blurred vision, I suggest you get a blood test. It's often how many people figure out that they have diabetes to begin with. You don't always have to have family members with it. You don't necessarily have to be overweight either. So it's a quick blood test, and I think it's a good idea to have blood work done at least every year, whether you've got a concern or not. Another issue on why people may be fatigued or particularly tired, especially women, is anemia, which is a lack of iron in the blood or from blood loss. Usually for us women, it's from our menstrual cycles. It can be seen in chronic issues, especially digestive, in which you're not able to get the nutrients you need from your foods. It could also be in those that choose not to eat foods that are rich in iron. A great source of iron is an animal protein, so vegetarians tend to have to work a little bit harder at getting their iron levels optimized. And for those with heavy menstrual cycles, speaking with your OB-GYN on what can be done to kind of help control that. Or of course, there are natural approaches for fibroids and things like that that can contribute to blood loss or anemia. Many choose to take supplements, which is fabulous as well. There's certain forms that work better than other ones. Cancer is also something, an early warning sign can be fatigue, especially where it doesn't make sense. Rheumatoid arthritis can be another one, especially if there's any pain or other issues that could be going on too. And chronic fatigue syndrome is some kind of catch-all phrase of just don't know why you're so tired. I see chronic viruses and bacterial infections as a cause of chronic fatigue syndrome. Certainly Lyme disease on the East Coast area and other parts of the nation have issues with Lyme disease that a lot of doctors don't check or believe in the value of checking. Certainly low vitamin D deficiencies can be a cause of fatigue or just low nutrients in general. So what should we do about it? What's the first step? So I suggest with people is to clean up your act. Really make it a priority to get good sleep, make you the top of it, telling your social obligations that maybe that just for the next couple of weeks you just can't do those things, staying out late, over celebrating, which is probably not a good time to be talking about this. Cutting back on restrictions, get through the holiday, and then think about what we can do for it. There are other things that we can think about as well, about decreasing caffeine, especially later in the evening, which just sort of makes sense to me. Moving your bed, perhaps, or looking at your sleep situation as well. More on that later, but for many people, they just need to get a better bed. I suggest taking multivitamins and fish oils to make a big difference too. Just give your body every chance it can to help you heal and then do better. Drinking water, flushing it out, even with green tea would be helpful. Move the toxins out. Exercise, even just a stroll around the block, getting up, just taking a flight of stairs. You've got to move your body or you're going to lose it. And that goes along with stretching as well. Simple stretches to do. It doesn't have to be complicated. It doesn't have to take a whole lot of time. There's just so much out there. eating well, less processed, more local foods, things that you know your mom would have wanted you to eat are still really important and do make a difference. So do all these things for about 3 weeks. If you're not feeling better or doing better, then I suggest you consult with a naturopathic doctor or other holistic healthcare provider. There's some fabulous herbs. There's some other specialty tests that can really help figure out what's going on. And once you know what's going on and why you feel so tired, then treating it gets a whole lot easier. Thank you so much for your time and your attention this morning. Have an excellent afternoon. Again, I'm Dr. Veronica Haydock.